let's start the debate. The first speaker for the proposition is known to you all, I think, Natella Rakhmanina, and she is going to be speaking in favor of the proposition, U equals U applies to women.
Okay, these 19 people in the room, are you seriously doubting that men are equal and women and U equals U? Well, let me try to convince you otherwise. So where is the chicken, where is the egg? Actually, treatment as prevention was started by a very well-recognized leader in this room, Dr. Muffinson, who generated multiple PMTCT trials. And the concept of suppressing virus in one body in order to prevent transmission to another body, whether this body is within you or whether this body is already detached from you, existed since these times. It proceeded to go to HPTN 52, and I really listed the moral milestone trials and partner 1 trials for heterosexual couples. And then for homosexuals, you can see partner 2 and opposite attract trials. These are truly the major landmark trials in the field. And I hope you can all agree with me that the proof of concept is a prevention of mother-to-child transmission. So why are we even talking about does it apply to women when women originated the whole U equals U concept? My opponent is quite experienced, as is Hollywood, can say wonderful, wonderful stories. Some of them might not be true, some of them might play on your feelings. And you can really recognize a Hollywood star from 2011. She's very experienced to put on a nice picture that can lead you in your feelings and in your mind. But let me look, what is the difference between men and women? Undetectable, untransmittable. Men and women, on your right is the same, heterosexual relationship. On your left, there is a difference, because for men, MSM and versus breastfeeding consideration in women. So let me go over these 2 considerations for women. First of all, the science is clear. Please go to NIH website, and NIH website says the science is clear. And NIH website says in recent years an overwhelming body, please look at the word overwhelming, of clinical evidence has firmly established U equals U, and it doesn't talk about men. It says people. Are women people? We are people, and we apply to that in a sexually transmitted sense. And this is for sexual transmission piece. My opponent is going to try to raise a lot of fears in you. And only 2 people so far who are really afraid. The rest is semi-afraid. So she's going to tell you about antiretroviral drug concentrations, genital tract or not. Virologic control in genital tract. Do we have viral suppression there? She's going to might scare you with biological differences in HIV and immunological function between men and women, anatomical, physiological risk factors, heterosexual intercourse, and all of that on the sexual end. Where I think she's really going to try to scare you is going to be from that lovely video that she co-authored. And that lovely video is available on YouTube. Look how scary these breasts look. They are full of viruses. And there are a couple of those viruses that are really mean. They have green stars around them because there are HIV reservoirs in the milk. And you are going to hear a bunch of scientific terms like mammary epithelial cells. I can't even pronounce all of them. And you are going to hear that all of these cells, independent of ART, are running to the baby from these 2 blue breasts. You are also going to hear that breast conditions such as mastitis and engorgements are common and definitely will push the virus too. You are going to hear about the viral bleeds during breastfeeding, and you are going to hear about suboptimal ART adherence postpartum and throughout breastfeeding. But my friends, suboptimal ART adherence for men plays the same role. And she's Canadian, and Canadians are really good about proving why is there 99 reasons why Canada is better than United States. But you forget that America is thriving. America is flourishing. And yes, America is winning again like never before. So I'm hoping that we will prevail in this debate in a Canadian counterpart. Please, do not feed your fears. Let's look at the evidence. Here's your evidence. HPTN 52, 1763 HIV discordant couples from 9 countries 98% heterosexual couples, 49% HIV-infected women in the ages of 18 to over 40, majority 26 to 40, 96.4% reduction in HIV transmission with early ART. And when they looked 5 years follow-up, 97% retention, extremely durable protective effect of ART, maintaining viral suppression, and no link transmission identified. I would say enough evidence to overcome the fears. Second study, Partner 1 study, 1166 HIV discordant couples, 14 European countries. Viral suppression was said to be below 200 copies. 2.8 years of follow-up for a couple where a woman was HIV positive, where U equals U really matters. 58,000 condomless sexual acts. No linked HIV transmission identified, and results were not affected by STI or likely viral blips in this study. Partners PrEP trial, I didn't show you that one before. It's a PrEP trial, but there is a U equal U concept there. 4,000, almost 5,000 heterosexual discordant couples from Kenya and Uganda, 40% were women, had 10.8% of unprotected sex on the visits, and viral suppression was low. Here, that's a study that established we really need 6 months of viral suppression, but no linked HIV transmission once viral suppression was maintained for 6 months. And look at the comparison between men and women. They actually looked at the viral load and the cervical and seminal HIV RNA, and men did worse than women, 21% in males and 12% only in the cervical or genital fluids in females. So I don't think I need to continue making the case for U equals U in sexual relationship. These are solid clinical trials, prospective studies, well done and well designed. So I think I put your fears a little bit to rest there. Well, let me move to the breastfeeding area. Go to NIH website. HIV therapy for breastfeeding mothers can virtually eliminate transmission to babies. Are there some specifics to this U equals U? Yes, there are. We want a lower viral load because we have seen that less than 100 copies, and I apologize, it says milligram per milliliter, it should be copies. It means less than 40 copies in the breast milk. There are no MTCT transmissions with mothers in care and who are suppressed. And overall, there is across all countries changing attitudes toward the breastfeeding and resource-rich settings. No, you did overtime. I'm going to finish. Give me 2 more minutes. Almost done. Okay, so just to say, Lynn mentioned promised postpartum results, 1,220 women on ART. Here you can see at 12 months, only 0.6% transmission, 12 months of breastfeeding. Now, everybody counts unprotected sexual acts. I'm going to count unprotected breastfeeding acts. First 6 months of life, on average, 7 breastfeeding acts a day. 6 months later, on average, 5 breastfeeding facts a day. And this is about 2,190 breastfeeding acts per day per woman. And if you multiply that, that's how many it is. No sexual reproductive study has had so many contacts with undetectable viral load compared to breastfeeding acts. And on average, this is how frequently we're having sex compared to how frequently the baby feeds on the breast. So you make your own call. And as I finish, Lynn has shown you on average 1.3 at 24 months with ART. And I'm finishing up, U equals U for women. Is there any question mark? Overwhelming evidence supports U equal U to women applies in sexual relationship. I think even more overwhelming evidence supports U equal U applies to breastfeeding women if you count the numbers of the breastfeeding acts of the woman who is suppressed. Challenges do exist, durability and adherence, I don't deny those. But these challenges are universal, apply to men as well, and doesn't mean that U equal U does not apply to women. Listen to a very wise man who said, from a practical standpoint, the risk is 0, so don't worry about it. U equals U apply to women, and do not listen to my counterpart, and do not impeach U equals U for women.